Hi everyone, I'm Dr. Bernard and welcome to Before and Beyond. So I'm just going to let you have a look at this picture right here. It's a typical picture that we take in our examination visits. And what we look out for when we take these pictures is to see what type of wear that happens on patients' teeth. And I want to just highlight a specific area that we tend to consult with our patients about. And so if we look down here where I'm circling with my blue marker, you will see patterns of wear on the lower front teeth that's indicative that this person is grinding their teeth quite significantly. And not only that, we see a lot of erosion with the teeth as well. So when there's this dulling or ditching effect on the teeth, we will notice that we suspect anyway that the patient has a lot of acid exposure with the teeth. So what do we do about a case like this? It depends on what the patient really wants, but in this particular case, this one gentleman wanted us to assess and make his smile a little bit more beautiful. And the first thing that we want to assess is to make sure how much of good tooth structure that we can work with. Now, the good news is that his base tooth structure is pretty good. And we can see that his midlines are actually not too bad with his face as well. Okay, so what we want to do is then design the teeth in such a way where we can potentially cover all the areas to his teeth so that we can use ceramic. The other option is to put composite resin on the teeth, and that will also solve part of the color problem. The only issue with someone who's such a severe grinder as he is, he could potentially break or stain the resin as well. So if we look at his back teeth here, he's got some bridges that he's had before. There's a crown right there and a couple of crowns right here. He didn't really mind the appearances of them, so we try to leave the back ones alone. But if we were to put veneers on his front teeth, the things to look out for is that we want to make the lower front teeth look and appear quite aligned. Then we will redesign these teeth using some small design software so that we can do a mock-up of the teeth to rebuild them. But the color will also be then dictated by the patient, but also if we want to try to match it with these teeth here, we will actually start getting all these teeth to be a slightly lighter color, perhaps to match the ones at the very back. If not, we would get a mismatch of colors. Not so bad if the top front 6 and the bottom front 6 teeth at least are quite an even color. So in a case like this, what we would say to the patient is that, oh yes, we'll take some scans of your teeth, take some other pictures as well, and then we can plan for how many veneers would it take to make it look very nice and also not to look too unnatural as well. Okay, and that's how we would discuss getting the teeth to be beyond what it really is. And so this is this episode of Before and Beyond. See you again.